Well, good afternoon, everyone. Thank you for being here today for our Partners in Prevention webinar. So my name is Laura Griggs, and I am the Child Abuse and Neglect Prevention Unit Manager at the Prevention and Community Support section within Georgia's Division of Family and Children's Services. And I will let Jill introduce herself.
Hi, I'm Jill Walsh, the Assistant Director at Prevent Child Abuse Georgia. We're housed in the School of Public Health at Georgia State University.
Thanks, Jill. And I wanted to thank Jill personally for letting me kind of jump on this webinar with her. This is a webinar that she created with Prevent Child Abuse Georgia to kind of provide a high level overview of prevention and to talk about strengthening families and communities in our state. And so she's going to give an overview of the programs that they offer. And I just jumped on to add a couple of our slides and provide an overview of what our prevention section funds throughout the state. And we'll talk a little bit about child abuse prevention in general. So I guess we can go to the next slide. So this is, I thought I got rid of these transitions, but I did not see. Yeah. Thank you. So this is the goal of DFCS. The mission really of DFCS is to prioritize the safety of the state's children in the decisions that we make and the actions that we take, and to strengthen families toward independence and build stronger communities. And our prevention section sits within the division. And our goal really is to work in partnership with community-based organizations who are working to reduce the incidence of child abuse and neglect and improve the overall well-being of Georgia's children and families. Next slide. So this is just a little overview of the prevention section. So up until 2008, we were the Georgia Children's Trust Fund Commission. And in 2014, Georgia's governor created a state agency called the Governor's Office for Children and Families, which had a couple of different divisions within that office. And one of them was focused on child abuse and neglect prevention and strengthening families, which is, the work that we still do to this day. But in 2014, Governor Deal broke that agency up and sent the different sections to different state agencies. And so in July of 2014, we joined Georgia's Division of Family and Children's Services, where we are today. And no matter where we've been housed, our goals have remained the same, which is really to keep families out of the child welfare system. And we do that through a focus on funding primary and secondary prevention efforts throughout the state. And Jill's going to talk a little bit later about the differences between primary and secondary, but you can see some of that on the slide here, that primary is really targeted to the community at large, and secondary is targeted to families where there may be risk factors that could potentially lead to child abuse or neglect. We also have within our prevention section, as we have grown, once we moved to DFCS, we've grown significantly. We now have 3 different units within the prevention section. So one is CANUP, which is the one that I manage, Child Abuse and Neglect Prevention. And that's the one we're going to focus on today with this presentation. But we also have an adolescent pregnancy prevention unit and an out-of-school services unit that make up our prevention section. But all of us contract with local community-based and statewide organizations. So that was a lot of info, but next slide. This is, I believe, the most updated picture of our staff. I know we just had a new staff member join us last week, but this is a photo of us volunteering at the Atlanta Community Food Bank, and that was taken this month. So next slide. Thank you. So I mentioned that I'm with the CANUP unit within the prevention section. So these are our goals. We use state and federal funds to provide funding to organizations who are working to reduce child abuse and neglect, or not reduce it, sorry, prevent it. And we try to manage those funds, obviously, in a fiscally responsible manner. We work to build capacity through statewide training and coordinating with other agencies to do that. We identify statewide needs and then release grant funding opportunities for those to meet those needs. And we monitor program outcomes through site visits and processing of reports, and serve as fiscal stewards of federal and state child abuse and prevention funds, and then provide TA and training to our partners and our contractors, and also serve as statewide experts on child abuse and neglect issues. Next slide. And so with the programs and services that we fund, we hope that all parents will learn positive skills to help them meet the needs of their children, that all children will receive age and developmentally appropriate life skills training, that all families will have access to supportive resources in their communities, and that families will be involved in the prevention planning and evaluation. One of the ways that we do that ourselves is we have something called the Georgia Parent Advisory Council. We have family or parents that serve on that council and assist the division, but specifically our prevention section with planning and evaluation of prevention programs. And we hope that child abuse and neglect prevention will be integrated into all community and state systems that provide services and support to families. And that's demonstrated through policies, training, programs, and budgets. And that systems will collaborate and cooperate in planning and implementing a comprehensive continuum of prevention services. Next slide. So to accomplish all of these goals, we fund several different types of prevention programs. So you can see some of the characteristics up here, but we have home visiting programs, social emotional learning curriculums that we fund in schools, suicide prevention programming. Family resource centers are a big one because they offer a multitude of services and programs at one location. We have our First Steps program, which is a universal screening and referral system. Triple P is a group-based or seminar-based parenting program. And I'll put our website in the chat in a minute so that you can stay updated with the different programs that we're funding at the moment, and then be provided with any updates or information concerning programs that we fund in the future. Next slide. Oh, this is another transition one, but I think there's there's one more, I think. Perfect. So these are some of the statewide initiatives that we're a part of or that we fund. So I mentioned the Georgia PAC, the Parent Advisory Council. We also provide funding to Georgia Family Connection Partnership to Prevent Child Abuse Georgia, and the Georgia Family Support Network and Strengthening Families are under Prevent Child Abuse Georgia now, as well as Essentials for Childhood. So really, PCA Georgia is our biggest partner in this work. And so I am going to go ahead and turn it over to Jill to talk about some of the programs that they provide.
Thanks, Laura. Sometimes I feel like we work very closely together, that we're more extension of office mates and colleagues than separate entities, and how we can best get this work done collaboratively for all of the state efforts and locally. So here is our team. We're just missing one. We're missing Melody Weaver, the Georgia Family Support Network coordinator on here. But this is us. So we're small but mighty and do a lot of programs. We also have students. We usually have 2 to 3 students since we're housed at Georgia State University. We usually have a couple of master students working with us in a variety of ways. But we have been in existence since I think 1981. It briefly closed down in 2011, and then it reopened that same year under Georgia State University because we're part of a larger research center that focuses on child maltreatment prevention. So you might have heard of the evidence-based program, Safe Care, also the Center for Leadership and Disability. And then there is us, Prevent Child Abuse Georgia. And we like to think of ourselves as the very outward facing and partner engaging way that we talk about prevention. So we're not a single kind of direct service, but really I'm representing advocacy and education across the state. Some of our core work, much as Laura's office at PCS, we provide a lot of technical assistance, which is sometimes difficult to kind of wrap your head around, but really we help community-based organizations try to implement prevention programs, and not just programs that directly serve families. Many of them are already doing some of that, but they're doing it through a DFCS referral or families that already have a lot of risk factors. And we want to help them also include an additional layer of primary prevention. So how they can serve families to prevent those additional risk factors or before it comes a situation that needs to be coming to the contact of DFCS. So how can we build strong families from the get-go? So not only helping them implement those strategies, but helping them spread the message of what true primary prevention is, because many people want to prevent it, but don't know what that looks like. And so that's where we help all those direct service agencies and throughout local communities better understand that and kind of amplify our voice in that. Understanding that many families are coming into contact with DFCS, not because of abuse or neglect, but because of not knowing who else to go to for resources. PCA Georgia started the 1-800-CHILDREN number a long time ago, and we have transitioned that more recently into Find Help Georgia. So this is a kind of centralized hub that connects families, and providers can use it to connect families with resources as well. We also serve on a lot of partnerships and coalitions and task force to get this work done and coordinated throughout the state. So I'm going to go over some of what these collaborations look like and what of some of our training programs look like to give you an idea of what we do. As I'm always trying to explain it to my parents and others, my sister who's a teacher, so they have very set what they do every day. She's like, what do you wake up and do every day? How do you know what to do every day? There's lots of work to be done. And so we have these certain buckets and missions that we're trying to follow. Part of what we do is we have a statewide network of local councils. So they're usually standalone nonprofits who want to add that additional layer of prevention into their services. So sometimes they're doing treatment or intervention after the fact, but they see the need for primary prevention. And so they're coming to us and working with us of how to build that additional layer into their programming. So some of them are CASAs, court appointed special advocates. Some of them are family resource centers or child advocacy centers that want to build that additional layer of work. And they really help us to raise awareness and do education kind of at the local levels and create partnerships there. We also are one of the backbone organizations for the Georgia Essentials for Childhood. This is a C2C framework that is based on kind of collective impact and how do we kind of guide this work forward as a collective. So a lot of states are implementing this, and Georgia is one of the kind of, I would say, semi-funded states implementing this work. So we have a large partnership and we have work groups that you can see up on the screen of how people are putting out messaging, how people are collecting data, making data-informed decisions, how we're putting out the child abuse and neglect plan, and also looking at policy that impacts child abuse and neglect as well. And so we try to just really, all the partners in the field be on the same page and putting that collective effort forward rather than duplicating. We were also working with the PCS in developing the state's prevention plan for child abuse and neglect called the Vision for Child and Family Wellbeing. So I think it was 2019. Our offices came together and went on a road trip and did a lot of virtual sessions. I think we engaged over 1,000 people throughout the state to collect input on what they thought we needed to move our state forward in terms of building stronger families. And based on all of this, and also some key expert information and state leaders, we came up with 6 objectives and then lots of things under there as well. So the 6 objectives listed in this plan are to increase family economic stability, to increase family resilience, to increase access to early childcare education, increase family mental health and physical health, and also to increase the kind of community knowledge and awareness of those societal factors that contribute to abuse or neglect. So really kind of that primary abuse and neglect education that we want it to spread throughout. I'll go back to that one for a second. So we have been implementing this plan for about 5 years now. We have regional leads that kind of establish little coalitions and meet up locally with people to see how they can help progress some of the state plan forward. And at year 5, we're doing a bigger evaluation and kind of re-envisioning and adjusting to how we can have a better impact from what we've learned to doing the first 5 years going forward. So it's going to be kind of a relaunch, I think, in the next year of what our state prevention plan is going to look like and how people can more actively participate in it. So be on the lookout for that. Another program that's kind of, I think, an initiative that we house is Strengthening Families Georgia. So there is also a National Strengthening Families. And so this is the Georgia chapter of it. It's a multidisciplinary partnership of nearly 50 national, state, and local partners that come together. And their goal is really to embed these research-informed protective factors. So instead of just looking at risk factors and how we reduce those, we can focus a lot more on these protective factors that we know that all families need and can build all families up, right? We can't always prevent risk factors from occurring, but we can always help families be stronger by putting in these protective factors. And there's a lot of new research showing that the absence of protective factors can be more damaging to the outcomes than having ACEs or early adversities. So this is a great place for everyone to start. We have the protective factors: parental resilience, social connections, knowledge of child development, concrete support in times of need, and social emotional competence in children. So they work really just to embed this in a variety of ways, from getting them embedded in decal, getting them embedded in high school and technical colleges to teach these to future parents, into early care centers, into family resource centers as a big part of their standards of practice of how to build each part of these for the families that are coming into the system. And this is really a family centered approach to build them up and to start with a strength-based view. And Kendra Cole is the lead on that initiative. If any of you interact with her, she is awesome. So I'm going to talk a little bit about kind of our general education and training programs. We host a lot of different curriculums at PCA Georgia, and then we also reach out to other experts to come do presentations. We have an annual conference, and we're just always trying to disseminate information that it has the best evidence, that is innovative, and really just what's kind of relevant in the field and what's coming up on the horizon even, and how we can implement what we see successful in other states. What does that look like for our state, and how can we help guide people there? So some of the curriculums that we house and we also offer trainings on regularly and on demand by request is mandated reporting. We also have a new version of it called Mandated Supporting Lean on Me that is really helping to resource families rather than to report them when appropriate. We do a lot of child sexual abuse prevention training with the Georgia Center. We do training on perspectives of poverty, as it is deeply tied into families who are in the system of DFCS. The protective factors from strengthening families, Connections Matter, which hone in on just that social connection one. And then also No Hit Zones, which is about the use of physical discipline and having that difficult conversation with caregivers, as physical discipline is now considered an adverse childhood experience by the CDC and others. We do webinars on special topics. And again, that annual conference this coming year, it'll be September 11th, which is a Wednesday, I believe, in Peachtree City. We also put out a lot of resources on just what prevention is. A lot of people are coming to our site looking for abuse statistics, but we really want to guide them not to what just the issue is, but how to fix it and solve it. We don't want anyone to leave our site without some idea of prevention, not just to get kind of the salacious material, but to guide them towards a solution-based resources as well. So we put out a lot of fact sheets, linked to other resources. We have a prevention model that's interactive. And every year we also put out a community action guide that's lots of easy messaging, talking points, lots of social media content. So it's easy for others to join in with us to spread this message and really amplify it much greater. And April, of course, is Child Abuse Prevention Month. So lots of people are kind of putting that out and releasing it out with us in tandem. And that's always great to see. A newer program that we do is the ambassador program. So we're kind of engaging emerging leaders and equipping them to amplify our voice and to be prevention leads in their area. So this year, I think we had 12, 13 people go through 10-month program where they were taking monthly kind of webinars with us and education. They had to do direct service volunteering. They had to host an awareness event and also help fundraise, because that's an important part, I think, of any nonprofit that's focusing on this issue, is being able to ask others to also invest in this mission. So we are wrapping that up and actually have our graduation celebration next Monday of it. And we'll continue this on. The next cohort will start, I think, January 2025. So we're already in the pre-planning for that. So I mentioned earlier on that a really big bucket of our work is around Find Help Georgia. So Find Help Georgia is a flexible navigational tool to better link Georgia families and family-serving professionals to available concrete support and local resources. And we know that families coming into any program likely have many needs. So whether your job is to directly resource navigate for families or not, you're probably doing it anyways. And you might not know what's always available in your area or in the area the family lives. So using Find Help Georgia makes that easier for them. So whether it's you on behalf of a family or a family themselves, they can go in and search by keyword. They can download the mobile app. They can even call the helpline with this and speak to a resource specialist. And we know that's important because many families don't know what to Google, but rather they have a story or a situation or a whole cosm of things going on, and to be able to talk to someone who might understand what is most relevant for them, what they might be eligible for, is really going to help them take that next step to reach out for help from those resources. We have lots of promotional material that we are encouraging people to use themselves and with families to give it out directly to them. The helpline is bilingual and they use a language service for other languages. And also the website can be translated into 100 languages, and you can send people resources directly from there via text or phone so they can access it and look at it in their own language. And so these are the 4 different ways that you can utilize Find Help Georgia, just by a zip code and keyword, online chat. People can call in for help, and they can also download the mobile app. I know this is a really good option for people who are working in the field. Maybe it's home visitors, other direct service providers, so that they can show the families right there what might be good for them, send them a text, or just show it to them and encourage the family to download it themselves, so that they can have that in their hand and search. We know some people don't want to seek out help directly or always ask questions, but they can do that self-search and remove that barrier. So those are the biggest kind of buckets that PCA Georgia does. If there's any questions, feel free to put them in the chat box or come off mute. But if not, I'm going to talk a little bit about child abuse and neglect, some early adversity, and then get into what we mean by primary prevention. So just a little bit on the impact of child abuse and neglect. And if you have been in this field, which I think almost all of you have been, you've likely heard of ACEs, or early childhood experiences. And those are often traumatic events that have negative and lasting effects on the health and well-being of children and on into adulthood. So many children who experience ACEs have a parent or caregiver who's also experienced early trauma. We know this can be generational. So on the left hand of this slide, you can see a list of what is considered an adverse childhood experience. This is according to surveys that we take. We know there's many, many more early adversities that people experience at the individual and community level, and really even societal and generational level as well. But what we've collected data on in Georgia specifically, we have up here on the slide. So the data shows that for Georgia, 3 in 5 Georgians surveyed had experienced at least one early childhood adversity. So that means that ACEs and early childhood adversity are really more common than not. And ACEs such as child abuse and neglect can have really high levels of stress. And when the stress is frequent and prolonged, it really dramatically changes how the brain develops. So, in the absence of supportive relationships and community resources, these early adversities can affect a person's health, educational attainment, economic opportunity over their lifetime, and can really carry on to that next generation, as I said. So while abuse and neglect occurs in families of all ethnicities, it's important to acknowledge that Black and Brown families continue to face systemic racism and differential access to support services that can really protect against abuse and neglect. So having being really forward in equity and promoting that in all of our programs and at our policy level are really important to help overcome those inequities that have really intentionally been put into place over the years and are still there. I also want to say that the number of ACEs a person has in childhood and the risk of negative health outcomes are related. So the higher number of ACEs directly correlates to higher risk of poor health outcomes. We call that dose response. So as the number of ACEs increases, so does the risk of alcoholism, depression, liver disease, suicide attempts, smoking, heart disease, adolescent pregnancy, and the addiction to drugs, poor work performance, and really can even culminate in premature death. We have that kind of cascading effect in that pyramid right there. But it's important to remember that the poor health outcomes noted in all of these studies, they're not total predictions. So similarly, the adversity someone experiences is not the cause of poor health outcome. It's only a correlation to higher risk. And we know that by having protective factors and positive experiences in the life of a child, we can really mitigate a lot of these negative health outcomes by having those in place. Whether they've experienced early trauma or not, that's something that we can always do. And that's really good news for us that we can't always impact risk factors, but there's always something we can do to mitigate the outcomes and have better outcomes for families. So we just talked about early adversities, and we're going to move on to talk about prevention, which is kind of the solution. What does the absence of abuse look like, and how do we all get there? And really, I'm going to ask you all. So I don't think there's anyone that's against the prevention of abuse. So why is it still occurring? It's because people don't know what it looks like in actions or how do we all get there. And so I want to hear from you all in the chat box or come off mute. So give me an example of what primary prevention looks like to you. So what does preventing child abuse and neglect look like to you? I'm going to wait until I see two answers. They can be really short and really simple, or they can be a complex web. I see Jennifer stepping in to throw me a bone. Thank you, Jennifer. Um, and Naja, so I see giving families information about resources and places to go to help mitigate abuse or neglect. Yeah, so there's lots of things and programs that are supporting families so they don't have to cascade into stress and chaos that leads to defects sometimes. Naja put primary prevention can be multifaceted. After school programs can be one source of prevention. Absolutely, after school programs are a great example. So we need children to have supervision that is appropriate, to be engaged, all of those things. Thank you, ladies. Usually when people hear child abuse prevention, it's hard for them to think beyond the actual abuse. Usually it's just the word abuse that sticks in their ear. And many people think that parents are solely responsible for abuse. So maybe they think telling parents to stop spanking or to stop being bad parents. I often hear that when I ask people what they think prevention looks like. And we don't believe in bad parents. We believe in parents who need more resources and opportunities and more support. People also think that if it doesn't affect them, it's more of an individual issue instead of a community issue or a societal problem. So if they think it's an individual issue, they're not going to look at these bigger picture solutions that we really need to move the needle in a large way. If we're always only focusing on one family or one individual, we're not going to create a bigger system that's supporting families. And that's the biggest prevention tool that we need and have. But it also takes the most work and the most collective action. So we need people to better understand that. I have a little video on it. And Laura, if you can give me a thumbs up if you can hear this.
There was once a carpenter that lived by a river in the village near you. Every day, with his trusty hammer, he built boats out of wood. One day, as the carpenter was working, he looked out onto the river and saw a child trying to swim towards the shore. "Help," said the child, "the current is too strong." So the carpenter grabbed a boat and rescued the child. "How did you get into the river?" asked the carpenter. "I fell in upstream," said the child. The next day, when the carpenter looked out onto the river, he saw two children struggling to swim towards the shore. "Help," the children said. The carpenter called out to another villager, and together they rescued the children. But the next day, there were 5 children, and the next day, there were a dozen, and soon the whole village was busy rescuing children from the river. The villagers grew weary, and some of the boats started to leak and break from overuse. The carpenter worked tirelessly to repair them, but as the number of children in the river grew, soon there weren't even enough boats to get the job done. One day, the carpenter asked himself a question. Why and how are so many children falling into the river in the first place? So he bravely ran upstream to find out. There, he saw a big, windy village with many houses, and some of the houses were in a state of disrepair. And when the wind blew especially hard, the houses creaked and cracked, and things were swept out of them and into the nearby river. Sometimes what was swept up was children. The carpenter saw an old lady walking by. "Excuse me," he said to the old lady, "tell me, why are these houses so broken down? Why aren't these houses stronger?" "The people of this village want to fix these houses so that they can resist the wind," the old lady replied. "But we do not have the tools to do so, and the wind lately has been especially strong." "I can help," said the carpenter. And with the help of the old lady, he gathered the villagers, gave them his hammer, and taught them how to use it so that they could learn to make their houses strong when the wind blew especially hard and keep their children from falling into the river. Yay! Because you see, if we make the effort to go upstream and help build strong foundations there, we won't need to work so hard to rescue children downstream.
So that was created by Claire Luge at Prevent Child Abuse Arizona. And it's a really good kind of metaphor when we're talking about preventing child abuse and neglect. We want to be thinking upstream. So not just kind of that constant boats coming in the water, although we need that too, but to look up to the solution of what's the cause of this and what's going on. A lot of our system is currently focused and funded in that boat area, the kind of after the fact has happened. If we only focus there, we're not going to prevent it in the first place. So I'm going to talk a little bit about the different categories of prevention. So we're going to talk about primary prevention, which is providing support to all families to prevent abuse and neglect before it ever occurs. So this is kind of a universal approach that we're giving everyone resources and access so that no one has to cascade downward. Secondary prevention, which targets individuals and families who are at risk for coming into child welfare system or might have already been in there a little bit. And then tertiary prevention, which focuses on families who are already in the child welfare system. So these are the families already downstream, needing the boats to come pick them up. So in the beginning of the video we just saw, we watched people, and people were focused on saving the children who are already struggling downstream. So this is reactionary. And that's, again, like I said, represents a lot of what our current system is set up to do and to respond to. And this type of response will never prevent children from entering into the child welfare system. And it's also the most costly. That one-on-one direct intervention is the most costly intervention that can be put in place. So we're already paying so much money for these systems that are not going to have large scale effects. So when we think of secondary prevention, these are measures that prevent children and family from coming into the welfare system, or for families in the welfare system from being separated into foster care. So this is kind of like the harm reduction. We already know there's risk there, maybe some harm. How do we reduce future harm from occurring to mitigate some of those risks? So for example, secondary prevention include mandated reporting or a defects referral for a caregiver to attend parent education workshops. And then at the top here, and this top is kind of representing the small piece of which we fund or focus on currently in our system. This is primary prevention, and this supports all families, not just the ones who are at risk who need it. And it prevents child abuse and neglect at its roots, at the cause, so that families don't become high risk to begin with. This looks like assistance with basic necessities, and this includes cash assistance, access to quality and affordable childcare and education, youth and adult education, and training that enables people to find fulfilling jobs with a living payable wage. So all of those things at the top. And a lot more of what's at the top, it could be universally funded parent education, home visiting that is given without a DFCS referral that is available to anyone. And it also represents a lot of policies that go on, like the earned income tax credit, and things like that that are broad sweeping to reduce poverty or provide extra resources for caregivers. And when we talk about a foster care system, actually, before I get into this slide, I'm going to do a little poll. Let's see if this works. I have a bad history of polls, but I still try. Okay, so this is asking you, what would be considered primary prevention? Mandated reporting, the First Steps Georgia program, which reaches out to new parents and provides some resources, or parent education through a DFCS referral. Two more seconds. Okay, so 80% of you said the First Steps Georgia program, and that is correct, because that provides services to families not based on risk, but just because they're parents, and all parents need support and resources because parenting is hard. Being a primary caregiver is hard. So that helps prevent the need for them to not know about services or not receive that. So it's a great intervention that also does screening and resources. Mandated reporting suspected abuse, we would consider secondary prevention, because that means that abuse has already occurred and we didn't prevent it in the first place. But we are able to prevent further harm from occurring by making that mandated report. Awesome job. Okay. So now a little bit about the foster care system. So when we talk about the foster care system, the goal is to create instead a child and family well-being system instead of a foster care system. And that means that preventing abuse and neglect, and we're helping every child grow up safely in their own family whenever possible. So rather than waiting for maltreatment to occur, we can improve the safety of children who have come to the attention of Child Protective Services by helping their families with evidence-based programs and promising practices such as cash assistance, as I said, or helping families earn that living wage. Most families are currently limited to using the bulk of many states are limited to use the bulk of the $9.8 billion in dedicated federal child welfare funds only for services related to foster care. In Georgia, we typically spend about $4 on foster care for every $1 on prevention. And imagine if we flip that. And it doesn't happen overnight or like a light switch, because we still need foster care until we can have more support for families. But if we started transitioning that and flipping that over, if we could prevent the trauma caused by coming into the system, or even the trauma caused by having all those different types of maltreatment or chaos within families, we can do a lot more good, because if our mission is to prevent trauma, from occurring in the first place. And that includes trauma by being involved with defects and family separation, which is a huge trauma, whether it's warranted or not. It's a huge trauma to all parties involved. And in 2018, the Family First Prevention Services Act passed. That's one of the biggest piece of federal legislative pieces regarding child welfare in a really long time. And so what this means is that states are starting to transition a little bit of those foster care dollars into prevention dollars. This includes money going towards substance addiction programs, mental health, parenting skills training, so that children can remain in the home. So we are investing in families to keep children in the home rather than paying into the foster care system for someone else to raise a child when appropriate, because many families coming into the system, it's really based on resources. And when we're looking at children removed from the home for foster care, about 20% of those are based on homelessness. And we know that's an economic issue that is not malicious, it's not otherwise. So we can invest in those families to become stronger. We can prevent separation and keeping identity of children and cultures and families together. And that's what we're really about. So hopefully we continue to see this. I will say that the Families First Prevention Services Act doesn't do as much primary prevention as it does secondary, but we're hoping to see that continue to transition to be direct cash assistance and to be other economic programs for caregivers. So we're going to go deeper on just a few more examples of primary prevention at the individual, community, and societal level. So at the individual level, we talked a lot about connecting families with concrete supports by using Find Help Georgia, programs that promote positive childhood experiences, such as mentorship programs, or even the after-school programs that Naja had mentioned, or building caregivers with social and emotional connections and networks, that they have someone they can call and talk to and vent to and share in those struggles and feel supported by. So peer support networks are a big thing as well. And also building on caregivers' knowledge of child development, when they can have realistic expectations and how do they best help their child learn and grow, that helps a lot. At the community level, programs like home visiting, which supports and educates caregivers. It also has a little bit of peer support with someone coming into your home and checking up on you. Community environments and structures or organizations that promote a sense of belonging and connectedness. So libraries, places where they have computers, they have reading programs, parents can connect with each other. It's a hub, they can use it as a resource. And just even having resource-rich neighborhoods, meaning that there's essential services there, like local medical care that is affordable to everyone, that accepts Medicaid and Medicare. Senior centers, libraries, as I said, food pantries, parks, safe areas to play. Another example is having families serving professionals trained in trauma-informed care or protective factors at the community level. So educators that are trauma-informed and others, that greatly helps reduce further harm and impacting it so that we can address these situations. And then at the bigger societal level, there's a lot that we can do. Sometimes it feels difficult as an individual. How do I impact this? But being aware of it, and I even say just signing up for Voices for Georgia's Children, Healthy Mothers, Healthy Babies, or a couple others, newsletters to stay in tune, and contacting your state representative. There's so much power, I think, at the state level. Your representative might have only gotten elected by a couple hundred votes. They are listening to their constituents, and they might not be hearing any other constituent emailing them on this issue. And so having you email them on this and giving them a little bit of information on it as a direct service provider is going to be huge. And you need to be careful sometimes as federal funding is passing through or other things like that, checking out your organization's policy and how you can advocate or not. But I know even though we're a state entity, I can't directly say yes or no to this bill, but I can educate them. Hey, this is what this means. The earned income tax credit does this for families. And here's what we see in other states happen. And that is me educating. I didn't say yes or no on this bill, but it is helping educate them as well. So doing it in that way is appropriate. So other policies at the societal level that help safety net programs, we saw during the pandemic, we were unprepared for people being in crisis. What if we were better prepared across the board so that we didn't have to wait for a crisis to occur? or for that family to be struggling, but we had something in place in advance of that. So we didn't have to have such a big dip go down or things happen. We were ready in advance of that. And so there's a lot of things from earned income tax credit, as I said, other policies that reduce poverty, more subsidies for early care and learning, after school programs, and the list goes on. I also have up there on the screen family-friendly work policies. This is a really big one. So how can we balance that work-life balance? In Georgia, we are #1 in the nation for small businesses. We're also #1 in the nation for small businesses because we put businesses first, meaning businesses have big tax breaks. They don't have to have all the same policies in place for their workers. We have the lowest minimum wage in the nation. So all those things that are good for businesses, but aren't good for families. So we want to see some of that shift into a better balance where we also have a better ranking nationally for child and family well-being. Whereas right now we're at 37th in the nation for that. So there can be a little bit more balance in there to meet both. I'm going to pass it back to Laura to talk a little bit about more evidence-based programs and strategies.
Thank you, Jill. So we know that was a lot of information and it's very high level. This is meant to just be a very kind of high level overview. But kind of to sum up what we've talked about, we know that no single program will be enough to prevent child abuse in any community. It takes a combination of different services, programs, and strategies to be put in place at once. And so some of the characteristics of those programs are that they be available to all populations. So that primary prevention that we talked about, that they be initiated early, that they cut across related problems, that they recognize cultural differences in families, and that they build on family strengths. So we talked about that, coming at things from a strengths-based perspective, and that there's no such thing as a bad parent, just a parent that needs resources and tools. They should provide intensive services to those who are most at risk. So a lot of that secondary prevention that we talked about. Be appropriate to address the different types of maltreatment and be evaluated regularly. Next slide. And so I mentioned at the beginning that our prevention section focuses on funding programs and services and initiatives that work to prevent child abuse and neglect and strengthen families. So these are some of the important components that we look at when we're looking at what we're going to offer funding for. So initiatives that educate and support parents to strengthen and expand their services to families. Initiatives that promote public awareness, violence reduction, and cultural values that discourage child abuse and support the needs and diversity of families. Initiatives that strengthen communities, increase social support, and reduce external stressors on families by assuring economic self-sufficiency and offering access to affordable housing, healthcare, and childcare, some of those policy level things that Jill talked about, as well as initiatives that are kind of on the child level to increase children's knowledge, skills, and self-esteem for their fullest development of their potential. And I think I'm turning it back to you, Jill, to kind of close out.
Yeah. And I'm going to introduce the theory of change. This was released by Prevent Child Abuse America at the end of last year. And it looks at a family and child well-being ecosystem where all children and families are living a purposeful and happy life with hope for the future and what that looks like in here. And I'm gonna just kind of high level, and you can raise your hand or just put yes and no in the chat box. Has anyone heard of social determinants of health? Okay, I'm seeing both. So social determinants of health, according to CDC, are conditions in the environment or kind of the context where people were born, live, learn, work, play, worship, that affect a wide range of health functioning and quality of life outcomes. So we know it's not just medical things that impact health. It's where you live, what you have access to, what you can afford, what education, what quality of education, what healthcare access and quality. Your area might not even have a labor or birthing hospital nearby or OBGYs. So that's definitely going to impact your health. Your neighborhood built environment, and also your community, how much you feel like you belong in your community and how much your community puts out there to create that sense of belonging as well. So all of those things impact our health. And many factors can impede the social determinants of health, and the stress caused from poverty, lack of access to resources, structural racism, and other oppressive conditions can place overload and overwhelm on the shoulders of caregivers. And this really hampers their ability to provide that supportive relationship and environment that children need for healthy development. We saw in the previous slides that our system is largely set up to intervene after the fact. So after families have substantially struggled through the child welfare system, which is costly and punitive, and also causes unnecessary family separation. But what if instead, what if instead of the DFCS child abuse hotline being the primary tool we give caregivers and communities to protect children, the tool was a family resource center that provided direct support, empathy, and empowering programs for families. And to take it a step further, I want you to imagine, what if our system provided greater social supports in an equitable way so that everyone could afford early childcare and education for their children? I had a baby in Belgium a couple years ago, and their childcare ranged between €5 and €30 a day, depending on your income, so that everyone had the opportunity to have childcare, to have respite, to have and work up in a career that they loved. There's just so much more people could do. And even just to have respite with childcare, or have the ability to stay in your job, or not have to choose between different things. It made such a big difference. What if all children attending a Georgia public school could receive the same high quality education? What would that mean for their future opportunities or the ability for their families? We know that our Georgia schools have inequities because you only have to talk to a real estate agent and ask, where are the good schools, to know that they are not all the same within our state. And we want to have the same access for healthcare and mental health services in a preventative way, rather than families having to wait till it's so serious they have to go to urgent care or the ER. What would that mean for their health? And lastly, I'm going to ask, what if we stopped judging caregivers who are struggling, and we really started to examine the barriers that have allowed them to struggle? And so when families have what they need when they need it in communities where they lived, and then it's also delivered in a manner without stigma before crisis, then we know that families can be strong and thrive. And that's what we want to build for them. And that's kind of the outline of this theory of change and prevention ecosystem. And we know that we can do that by embedding lots of protective factors and having greater awareness of these primary prevention measures. We wanted to leave you with a few additional resources, and I know Laura said she would send out the slides for this. So you will have them and receive them after this, but here's some great websites to continue looking at primary prevention, and also just best approaches in family support as well. Right, Laura, is that okay if either you send this PowerPoint out via email, or we can also send this list out of these extra resources via email?
Yeah, I can send both. Let's see, trying to see. You can share with me the list of who all's on, right?
Okay.
Yeah.
Will do.
Or actually just who registered. We'll send it to everybody, I think.
Okay, awesome. Here's our contact information. Yes, that was a lot of information. This will be recorded if you want to go back, and we'll send out the information after the webinar as well. We want to leave space if you have any questions or comments or anything like that. We'll stay on for a little bit, but that's the end of the official presentation.
Thank you.
Yeah, I'm seeing Gail say that your friend's son had a baby in Toronto and they get a full year of paid maternity leave. Yeah, to think of like that attachment and bonding early on, rather than struggling with who's going to watch my child, how do I get back to work? You don't have time to think about how you feel or getting back to just like your identity or discovering a new identity as a parent. Just
Yeah,
imagine.
just those
That's
early stages of development, being able to be there for all of that and not have the stress of childcare and all that, to me is going to be so interesting to watch. The dad just gets 8 weeks leave, which is still great. But yeah, I think that's a beautiful thing that they're doing that gives young first time parents especially a chance just to get their feet on the ground.
Yeah, it
Yeah.
takes a lot of the worry out of it. And I know in the state of Georgia, they just passed, they used to have 3 weeks of paid paternity leave, parental leave for state employees only. And now they just upped it to 6 weeks for state employees. So that's not across the board, but for state employees like educators, human services providers, that's a big new benefit that they have. Because it used to be 0 paid. You got guaranteed, they wouldn't give your job away, but you got no pay unless you saved up your sick and vacation.
Yeah.
This has been great. I was able to download that graphic, that theory of changes. There's so much good stuff there. So thanks for that link. I was able to print that.
Great. Yeah. Thanks for being on, Gail.
Yeah, no problem.